Have you taken the NCLEX and you're worried that you failed your exam? Well, in this video, I'm going to go over the top 5 signs that indicates that you likely failed your NCLEX exam. So stay tuned as we go over it right now. Alright, hi, my name is Nurse Choma, and like I said, I'm going to go over with you what are the top 5 signs that you may have actually failed your NCLEX exam. Now, obviously, these are not going to be absolute things, but this is going to be more than likely, most probably, that you may have failed your exam. Alright, so let's go over each of them. Number 1, the first one is if you got the minimum questions, right? And in this case, at the time of me doing this video, right now it's 85 questions. If you got the minimum questions and you are doing poorly or you weren't really confident with the questions from the beginning until the end. Now, it's normal for many people that as you get towards the middle of the test or towards the end of the test, you feel like you failed the test and then people still pass their exam. But I'm talking about from the gate, from the beginning, when you're taking the questions and you're going through each of the questions, you felt like you really didn't know what the answers were and you were second guessing a lot, right? So you're second guessing a lot and you got the minimum number of questions, it may be a sign that you failed your NCLEX exam. Number 2, the second sign that you failed your test is that you got obviously the bad pop-up, right? Now if you don't know what the bad pop-up is, I do have another video where I explain what the bad pop-up is versus the good pop-up. It's pretty much like a Pearson VUE trick in order to see if you failed it or passed it. But essentially, if you decide to do that, then you will get the bad pop-up, and that means you likely failed the test. Now, once again, there have been some instances where people said they got the bad pop-up and still passed, but most and majority cases, people failed, all right? Number 3, the third sign is that you were taking the test and the difficulty level actually got easier towards the very end. That's a bad sign, right? So what I mean by this is that, let's say, for example, you're starting the questions at the beginning. It's always going to be easier at the beginning, right? Because remember, it's a computer adaptive test, so it's going to adapt based on the candidate, which is you, ability to answer each pre-existing or subsequential question, right? So if you're taking the test and let's say it's beginning, it seems fairly easy, then it starts to get hard, and then at the end, a lot of the questions are super easy, like more basic. You probably didn't do very well. You probably did not pass your exam. The reason why is because the purpose of the test, for it to be a computer adaptive test, is trying to see if you can achieve the minimum passing curve. And so for that to happen, you're going to be going through the questions, and it should really be where the questions continue to get more difficult until the very end. If the questions start to get easier to the end, then it shows that the test discovered that you weren't doing well with the previous questions, and so that's why it presented to you much more easier questions. All right, and that could be hard to also kind of gauge a little bit, because sometimes, honestly, some people just really know their stuff so well where it felt easy at the end, so, but in most cases, that's what it may mean. All right, another sign that you may have failed the test is that when you're taking the exam, I've seen this a lot for a lot of people, is that you're getting a lot of the same type of questions towards the very end, and then it cuts off. All right, what do I mean by this? So I've talked to hundreds of students now over the years that have taken the test and they failed their exam. And so then I would interview them and ask them, okay, tell me in detail what the exam was like for you. And what we discovered, or what I discovered from talking to many of them, is that the ones that failed, is that they told me they started seeing a lot of the same questions right towards the end, and then they failed their test. So, for example, I remember I had one student where she came to me asking for help. I asked her, tell me what happened when you took the test the last time. And she said how she was taking the test and literally she failed the test. but she knows that as she was going through each of the questions, she got a lot of, for example, pediatric questions. Another student, same thing. She was taking the test and she got a lot of chemotherapy, cancer drug questions. So a lot of times, if you have at the end, there's not so much variety and there's a lot of the same type of questions repeatedly, it may be a sign that you failed your exam. All right. The fifth sign, the top fifth sign that indicates that you failed your NCLEX exam is that you ran out of time. All right. So this is now, for some, this will seem obvious, all right? But I'm not really talking to those people, right? So what I mean by this is that a lot of times when I have people that will reach out to me for help trying to pass their exam and everything, and they ran out of time. And a lot of times the reason why they ran out of time is because they just were not understanding the material fast enough. Okay, so first I'm going to explain it in general terms, and then I'll explain it as far as like the NCLEX is concerned. So let's say, for example, right, this is just to give you an illustration that we all would understand, is that I present you a basic mathematics questions, right? And I ask you, okay, what's 2 plus 2? And you tell me, and it takes you time to tell me, oh, it's 6. And it's the wrong answer, obviously. What's 3 plus 3? And it takes you 2 to 3 minutes to tell me, oh, I think it's 9. So, I mean, so it takes you a lot of time to answer the question, to think, versus being able to say immediately, oh, 4, 6, right? So a lot of times when it takes people a lot of time to answer the questions, there's a problem with their comprehension skills. So they're not comprehending the material fast enough in order to immediately identify the answer. So when it comes to the NCLEX actually has a run out of time rule, where if you hit the maximum time, which right now I believe it's 5 hours for the RN and 4 hours for the LPN, if you hit the maximum amount of time, the test will actually judge you, I believe, on the last 60% of the questions that you got, not the entire test. And the last 60% of the questions that you got is usually going to be the more difficult questions. So I've seen more than often that the people that failed their test that usually ran out of time. You do not want to run out of time. So you have to be mindful of how much time you're spending per question. And if when you're doing practice questions, it does take a long time to answer the questions, you honestly need to go back to the content. You need to go back to learning the material in a way that really makes sense for you. Comment below, let me know right now in the comments which of these 5 signs is making you feel that you likely failed your NCLEX exam, and how many questions did you get. Now, if you are in this situation, I want you to be successful. We've had over 1,000 people that passed their exam. A lot of them have been repeat test takers, and I want to help you to become next. If you simply click below this video, you can actually get access to my NCLEX retake rescue kit. This is a kit that you're literally going to have access to, where you're going to diagnose yourself and identify why you failed the exam specifically for you. Not only is it going to help you to introduce why you failed the test, but it's also going to help you to lay out a different plan, different course of action, so that way you can really truly be successful. Simply click below this video to go ahead and access it right now today. And if you use the coupon code YouTube, you'll get a special discount as well. All right. I hope that you found this informative, and I hope you learned something. Make sure to like and subscribe button, and I'll see you the next time.